Good afternoon, everyone. Glad to have you with us here on Facebook Live. I'm Hartford Healthcare's Brian Spyros. As we get ready to round out the month of October, we continue to have a very important conversation, as we have been all month, around breast cancer awareness. We recognize that this is obviously a conversation that should be had 365 days a year, but during the month of October, we really shine the spotlight on this disease. And today we're going to talk about several different topics that really could be life-saving for women, but also for men as part of this conversation as well. And joining me now to have that conversation is Dr. Whitney Young. She is a breast surgeon at Midstate Medical Center. Dr. Young, glad to have you with us here this afternoon.
Thank you so much, Brian.
All right, so a lot to unpack with this. Again, a lot of critical information. We're going to start with women. Obviously, they are impacted the most when it comes to breast cancer. Women often hear about performing self-exams, which are obviously important in finding something that may be abnormal. When should women be performing these exams, and what specifically should they be looking for when they're doing so?
That's a great question. So women should be thinking about doing a self-breast exam monthly. And I tell patients to typically perform this self-exam the week after their period. The breasts are less tender and swollen, and it allows women to have a sort of consistent schedule to get that done monthly. When they're doing a self-exam, women should be looking for any skin changes, any lumps or masses, any changes in the shape or projection of the nipple, any drainage from the nipple. These would all be concerns to give a phone call to their doctor, their regular primary care provider, or their OBGYN.
So if they do notice any of these, as you said, I think because sometimes a woman may not know what to do, or they may think that it's nothing, but they really should be reaching out to the OBGYN or their primary to just at least have it looked at.
Have a conversation, get an exam. Sometimes it prompts imaging. Really being an advocate is important.
So we know that sometimes breast cancer may not present in the form of a lump or something that is clearly visible to a woman during a self-exam. And that's where mammograms really come in, and they are important. Just kind of take us through what the mammogram actually does, what it allows doctors to see, and why it really is so critically important, and how often women should be getting them done.
Absolutely. So women should be getting an annual mammogram, and typically for your average risk woman, that should start at age 40. And mammograms allow us as a screening test to look for early signs of cancer or abnormalities. So mammograms allow us to look at the breast tissue and detect any subtle changes year to year. Identify masses, or sometimes even things like calcifications, which can be very subtle and wouldn't present as something a woman might feel. It allows us to detect cancers and other abnormal cells at a much earlier stage than we might otherwise.
So a lot of women put off their mammograms during COVID, not realizing that they could still come in. They were concerned about COVID. Just did a story with a woman who put off her mammogram. She finally got it last May, only to discover that she had breast cancer. And thankfully she survived, and she got through it. But can you just speak to the fact that if any women out there have put it off and they've gotten busy and they didn't get it done last year, how important it is to really get back into that routine?
Absolutely. There's no opportunity like the present to really to go and take ownership and really update that mammogram. Waiting another day is just too much if a woman is overdue. It's hard with COVID and life getting busy. It can get away from you, and all of a sudden the days become weeks and months. But really, I encourage women to partner with their healthcare providers and really stay updated with their annual mammogram, so that it may save their life.
Absolutely. We can't say that enough in all of this. You know, we talk about women who are at high risk for breast cancer. You had said mammograms should be starting at age 40. A woman out there may say, well, how do I know if I'm high risk and I should be getting, you know, a mammogram or a clinical breast exam done earlier? So what are sort of the parameters around all that? Because for some it could be confusing and they don't know where they fall in all of this.
Absolutely. So it's a dialogue that should be had with a healthcare provider. And really, when we think about women who are high risk, we're thinking about women who have family history of breast or ovarian cancer, or even other cancers where there's been sort of a pattern or predominance of cancers. We think about women who have had certain exposures, so women who have had radiation maybe for other reasons, other cancers at a young age to the chest. We think about women who maybe have had a biopsy and have had some abnormal cells, but not cancer cells. Those are women who all may be high risk and should start screening at an earlier age, even sometimes getting additional tests to just a mammogram. Now, sometimes that may be something like an MRI, which is one of our most sensitive tests to look at the breast tissue. But I also, think that it's important for us to think about ultrasounds. Ultrasounds are an important adjunct for women who have dense breast tissue and allow us to evaluate the breast tissue in another way for women who may have a challenging mammogram due to their density.
You know, I was going to ask you about any of those additional screening methods. So how does a woman know if they qualify for something that goes beyond a mammogram? Is that a conversation they would have with the doctor?
Sometimes it's a conversation had with the doctor. Sometimes it's a conversation on the day they're there with the radiologist doing their mammogram. There's a classification system to look at densities in a simplified way. It's categorized from A to D, and really women who have that C or D density classification on their mammogram should have a dialogue with their radiologist or with their primary care or OBGYN to think about adding in that annual screening ultrasound as well.
All right, good to know. As a breast surgeon, you have probably seen the gamut of types of cases, but can you speak to just what the outcomes are when a patient is diagnosed early and really, you know, the prognosis when that happens because they got their screenings or were doing self-exams and were being proactive with their health?
It's so very important because we see excellent outcomes when women are diagnosed with an early breast cancer. And so when we have an early breast cancer, we're able to perform maybe a less extensive surgery for a woman. Sometimes we're able to avoid something like chemotherapy, where if the cancer had presented at a later stage, may become necessary. So it really allows us to have optimal outcomes and tailor care and minimize, some of the more invasive parts of cancer care.
So we've talked a lot about women, obviously, and the one thing that people should know is that men can get breast cancer. It's not talked about often, but can you sort of explain, you know, are there screenings for men? Is there anything men should be doing? I mean, how does it present in a male? Is it different from that when it's with a female?
So similar presentation as females. It can present as a lump or swelling, drainage from a nipple, change in the skin or the shape of the breast or nipple. I will say that fewer than 1% of all breast cancers occur in men.
Okay.
When we think about women developing breast cancer, we think about risk of breast cancer in a lifetime being 1 in 8 women will experience a breast cancer. For men, that's 1 in 1,000. And so it's important for men when they do notice a change to be proactive and see a medical professional and get an evaluation, because exactly like you said, there's no screening test out there that we perform for men. But we would do the very same test that we do in women when they do present with one of these, findings of a change in their exam.
You know, you brought up the statistic from the American Cancer Society. 1 out of every 8 women will be diagnosed with breast cancer at some point in their life. That is pretty startling. I mean, as a doctor, I mean, that's, you know, you think of a woman and her group of girlfriends, and if there's several of them, one of them will be diagnosed with it. Is it something that you think a lot of women are mindful of and think about, because they do certainly get busy with life and everything going on, and this is really an opportunity to remind them that early detection, but the likelihood of this happening, it can be pretty high for some people.
Absolutely. It's so important. And I really challenge anyone who's tuning in with us today to update their mammogram, make sure they're up to date with an ultrasound if they need one, because it is so very common. And if you think about, you know, all of the female family and friends that you have, the likelihood that there's going to be someone you know, or perhaps even yourself affected is it's a possibility for sure.
Absolutely. So can't stress enough those self screenings, but also reminding that those self screenings may not detect something, which is why the mammograms are important. So a lot of great information, all of which can certainly be life saving. And this is something that women and, as we know, men, even though it's not as common, definitely need to be paying close attention to. All right.
Thank you
Dr.
so much.
Whitney Young, thank you so much for the perspective. We really, truly do appreciate it. If anyone out there has any questions, you can feel free to comment below. Of course, you can always visit hartfordhealthcare.org/breast cancer to get more information and to view all of our resources. Of course, our many dedicated team of professionals. Dr. Whitney Young is one of them from Midstate Medical Center. Dr. Young, thank you so much. And of course, we thank all of you for watching. I'm Hartford Healthcare's Brian Spyros. Have a great day.